Muscles tend to be agonists, and that means they produce a specific action or movement. And often they are also antagonists, and so they're going to oppose or reverse the action of another muscle. And we see this throughout the body. One example is the bicep brachii. It's going to flex, which shortens the angle of the arm. And on the other side of the arm is its antagonist, the tricep brachii, that's going to extend or work against the bicep in that action. Synergist muscles, they're going to help prime movers by adding some force, or sometimes they reduce extra movements. Good example, brachioradialis, flexor carpi radialis on the opposite side. They're going to help the bicep to flex the arm. The soleus does something similar. It's under the calf muscle, called the gastrocnemius, and it's going to cause the flexion, plantar flexion of that calf muscle. Synergists sometimes will take over if there's an injured muscle, such as the gluteus maximus, the huge buttocks muscle. If there's an injury there, then we can expect the bicep femoris and the semitendinosus to take over hip extension and rotation. If you look at the position of these two, the bicep femoris is on the lateral side and the semitendinosus on the medial side. Fixators are important, even though their job seems unimportant, because they're going to hold a bone firmly in place so that the prime mover or the agonist has a stable base from which to pull. Good example is the trapezius. It's going to hold the head, the neck, and the scapula all in place, nice and tight, so that prime movers can apply force. You see, we can't have that scapula flopping around when we're trying to do an exertion. The scalene muscles of the neck also, they were going to stabilize that area so that that massive sternocleidomastoid can pull and the head's not flopping around. Naming skeletal muscles, there's many techniques. It's not just one way. Location, good example, brachialis. Brachia means arm. Rectus abdominis, think abdomen. Pectoralis major, think of pectoralis, chest. Temporalis, the temples. And frontalis muscle, it attaches to the frontal bone of the skull. Other locations, orbicularis oculi. Oculi, think of eye. Nasalis, nose. Orbicularis oris, that's that kissing muscle. Flexor carpi radialis, it's going to follow the radius, which is the outer forearm bone. Palmaris longus, the tendon, you can follow that tendon right to the palm of the hand. Flexor carpi ulnaris, ulna, that's the elbow bone. Continuing with location, supraspinatus, supra means above, infraspinatus, infra below. Latissimus dorsi means wide back. Now if we look at the leg on the left, if you see the word lateralis, you think it's away from the mid. Rectus, think of parallel to mid. Intermedius is going to be in the middle. Think of intermediate. And vastus medialis is towards the midline of the body. Another way we name skeletal muscles is by shape. Deltoid, that's shoulder muscles, sort of triangular shape. Serratus, anterior. Those, it looks kind of jagged, the muscles below the pectoralis. Gracilis is a very slender muscle. I call it the inseam muscle along the medial side of the leg. Gracile, slender. Tensor fascia lata. That fascia means band, and that's that dense band of cartilage on the lateral side of the leg. Gastrocnemius, gastro means belly. It's sort of belly-shaped muscle. And soleus, think of sole, fillet of sole, flatfish. You see how we're running into many of these words again? Another way we name skeletal muscles is adductor longus. Longus means long. Adductor magnus, magnus means large. This poor gentleman in the 2014 Olympics injured his adductor longus, and what a marvelous skater he was. I was sorry to see it. Major, minor, okay, larger, smaller. Digitorum brevis, think of short. Abductor digiti minimi, that is the small. It's going to move that little toe. There are also the use of fascicles and fibers, just the direction of the groups of muscles. Rectus abdominis, external obliques. Okay, you can see the external obliques are going to go at an oblique or angular, and then the transversus abdominis is below the external oblique, and they go in a different direction as well. So we have a lot of power in that core that can move or depress the abdomen is the movement. Transversus straight angle, oblique means oblique to midline, and rectus straight. Another way we name skeletal muscles is by the number of origins. Now the origin is the non-moving place where the muscles attach. So quadricep, think of 4 heads, quad. Tricep brachii, tri means 3, and there are 3 heads. That's why generally the tricep brachii is the larger, more powerful muscle of the upper arm. And bicep brachii, bi meaning 2 heads. There's a long and a short. We also name skeletal muscles according to action. There's the extensor carpi radialis, and it's going to extend. The extensor digitorum, think of digits as fingers, so it's going to extend the fingertips. The extensor carpi ulnaris is going to extend. It's going to extend the hand at the wrist. And the extensor digiti minimi, think of digiti minimi, little finger, extends the little finger. When you're looking at these on a cadaver or a model, it's smart to find the tendon and then go upwards on the forearm. I find that easier myself. Action, brachioradialis. Think of that's that huge forearm muscle, the thumb side. It's going to flex the forearm. Flexor carpi radialis. It's going to flex and abduct the hand of the wrist. And palmaris longus, I've mentioned that one before, flexes the hand at the wrist. So we're on the palm side, which is called the anterior view. Origin, I mentioned origin, that's the stationary bone, but there's something called the insertion, and that is the immovable part of the bone. So let's look at the trapezius, the huge muscle, extending from the occipital bone all the way down the thoracic vertebra. That's its origin. The insertion is going to be on the clavicle and the scapula. Masseter, that's the chewing muscle, origin on the zygomatic, the cheekbone, and the front part of the zygomatic, the maxillary part. And the insertion is going to be on the mandible and gives us that powerful chewing action. Sternocleidomastoid, the origin is on the sternum and the clavicle, so it's sort of the shoulder region. The insertion is going to be on the mastoid process of the temporal bone, so behind the ear, the occipital area of the skull. Temporalis, I've mentioned this one. Origin on the temporal bone, makes sense, right? Insertion on the mandible. Latissimus dorsi, origin, and think about this, look at the muscle. You can see that the vertebrae are going to be the most stationary part, the sacrum, the ilium, part of the pelvis, and the insertion is going to be the moving part, which is the humerus. So there's a lot of muscles tied into that roughened area of the humerus, the upper arm bone. Review here. I've given you many words, but you'll notice that they repeat over and over again. The shoulder, trapezius, deltoid, tricep brachii, bicep brachii, brachialis, and so forth. So this is the anterior view. Here's the posterior view. So take a look, spend some time, and you'll start to find that it's not as complicated as it looks the first time around. So be patient. You'll get it. Good luck.